Welcome, everybody, to another Zoom call where I do my best to answer your questions that you send in or chat in. Reminder to everybody to please use the member site. So the member site shows all the announcements. No other big announcements, even though I did hear that TrueRife sent out an email today that you can download version 6.4 off the website now. However, I looked and you still can't. So I don't know what is about that. If you do download version 6.4, make sure you contact us because you will lose all your programs. So there's a way to do it. Way to do it correctly. You either send it to us and have us do it for you, and I'll put all your programs on and I'll make sure all your programs are up to 6.4 standards because some people's may not be. Or you do it yourself through the instructions on the member site and the Rife course site. And those instructions look like this. So you can go over that yourself. However, your program that I've created for you, even if you follow all these instructions and you save the program and you then put it back on, blah, 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 as per these instructions, it still might not be up to version 6.4, and you still might need me to send you a new program. So I suggest you send it to us to have us do it if you want your program updated to 6.4. However, they're coming out with a 7.0 very soon, so just wait. Okay, first question. I am in the hospital right now and they're draining off lung and tummy fluid. I will try to get results to you. I did not see any results right prior to this meeting. So looking again, no results. So no other information. All my liver enzymes have gone up. I'm assuming gone a lot. So I'm assuming that she means they went up a lot. I did bring my Rife, and I've been running the liver program under body function frequency set. Is there anything else I should be doing? Sounds like I will be here a few days. Yes, I would say make sure you're running your cancer programs. So make sure you're running your cancer programs because it is the cancer that's causing the ascites, not failure of the liver or something. So make sure you're running the cancer programs. A person sent in their Signatura test to ask to kind of go over it to understand what the Signatura test is looking at. So the Signatura test, this part of it is testing for what's called cell-free DNA or cfDNA. Now, cell-free DNA is the same thing that, for those that have been with me for a number of years, it's the same thing that the IBgene test tested for. So there's value in measuring cell-free DNA. Matter of fact, you can do a Google search on cell-free DNA, and it will tell you that cell-free DNA was a really, when it first was discovered to be able to be tested levels in the blood, there was a lot of excitement because it can tell you if a person has cancer before a lot of other objective tests can tell you. So it is still used in different tests. The Cologuard test, that is very widely advertised on TV, is a cell-free DNA test that's using that same technology. The IBgene test that we used to do is a cell-free DNA test. However, that company went out of business during COVID because they were trying to keep their prices down and sell to doctors like me to sell to patients, whereas like Cologuard, using the exact same technology, charges like $2,500, but they're going only through insurance and only through medical doctors in order to make it a profitable business. Signatura goes through doctors like me and other doctors that are doing alternative care, but it's more expensive test. And that's where IBgene had to either raise their price, either like triple their price to stay in business. And they just could not get, they just didn't have the advertising budget. They're a small lab. Even though they were a CLIA approved lab, they just couldn't stay in business. So cell-free DNA can be measured at different times, and the level of cell-free DNA, it is thought to then correspond to the level of cancer. So if that level goes up, then the idea is that the cancer is getting worse. If that level goes down, then the cancer is getting better. You're recovering. However, we have seen when we used the IVG tests for the 3 years that they were in business, that wasn't always the case. And so just like any other test, you cannot count on one test. This person's results actually show the cell-free DNA going down here over time. One done earlier in 2023 to end of August, September 2023 to this time that it's going down, and the person's condition appears to be not moving in that same good direction, seems to be moving in a worse direction sometimes. So it's very difficult to use one test to monitor. This is why I tell you, even with doing a CT scan or an MRI or using tumor marker tests, sometimes when you're actually getting better and your cancer's dying, the tumor marker test can spike, giving you a false positive that you think you're getting worse. Well, the cell-free DNA can actually go down when the cancer's growing too. So it can be confusing. Why is it? Because no test is perfect. They're just, even though things are a gold standard, there really isn't anything. Now, a visual presentation of the tumor in tests like a CT scan or an MRI may be considered the gold standard solely because you can physically see that the size of the tumor is getting larger if you have a solid tumor, and you could use a CT or an MRI. A PET scan isn't technically a visual field test. It's measuring uptake of glucose and increase in metabolic rate, but it's kind of on the same line. Whereas a blood test like this or a tumor marker test is measuring an outcome of cancer growth or cancer death. So again, no test is perfect. You look at one test and you compare it with other objective tests, and you compare it with subjective findings, meaning your symptoms and what else is going on in your body, how you're feeling, other signs like I'm getting fluid in my abdomen or I'm getting ascites built up, and the ascites is getting worse on a weekly basis, meaning they have to drain more each week. That would be a sign that the cancer is getting worse, or it's getting better, and I'm getting, even though there was 1,500 milliliters taken out one time, now it's now we're only taking out 750 milliliters every week or every 2 weeks. Well, that would be getting better. So you don't measure just one test, you look at as many tests as possible. There's a different person saying, I would like to try fenbendazole. Why not? How much should someone like me, 89 pounds, take, and for how long? Is there anything else to be aware of while taking it? Well, fenbendazole is a protocol that has been widely known as the Joe Tippins protocol because it's a guy named Joe Tippins who I believe had lung cancer, and he used this fenbendazole protocol and got better, and he's still alive today, where they had just given him weeks or months to live. So fenbendazole is used not by itself. So his protocol was to take fenben, so that's what you call it for short. Oh boy, come on, spell check. So you take fenben and then take curcumin, take APOP-E, which is the the type of E that the delta tocotrienol type of E, and then he expanded it to taking berberine as well, and then also taking a CBD oil. So this is the Joe Tippins protocol. Now, if you just call our office, we actually have these in packs and you can start taking it. Now, how much of the fenbendazole does someone take? Typically, in Joe Tippin's standard protocol of somebody who's either low weight or their cancer isn't all that aggressive, you just do 1 packet per day. Now, the product of fenbendazole that we have is 1 packet is for a 10-pound dog. So that doesn't seem like a very high dose because it's not. It's a very, very low dose of fenbendazole. But he recommended, and some veterinarians that recommend this protocol and alternative doctors that recommend this protocol, is that you do up that dose depending on weight. If you weigh 200 pounds, you probably have to take 2 or 3 packets a day. But it also depends. Like if your cancer is fairly stable and you just want to try the Tippins protocol, you might just start with 1 packet a day. If you weigh 240 pounds and your cancer is aggressive, you might take 3 packets a day. The other thing about this protocol, you only do the fenbendazole 4 days a week. So you do everything else every day, but you do the fenbendazole 4 days a week. So Monday through Thursday, you would take the fenbend, then Friday, Saturday, Sunday, you would only take these. Monday through Thursday, you would take all of these, and then Friday and Saturday, Sunday, you would only take these things. So everything except why this cursor's not working. Everything except the fenbend. But again, if you have a very aggressive cancer and you're getting worse, and your cancer is continuing to, grow, then you change that dosage. You don't really change doses of curcumin, APOP, berberine, and CBD, but you change doses of fenbend. You might take it daily. So when we test people for it, I test for how many packets and how many days a week. So it's all over the board. It does have to do with the person's weight, body weight starting off, and it has to do with that person's aggressiveness of the cancer. And fenbend can be used really for any cancer. I would say any cancer except typically it's not used for brain cancers. And it's typically not used for the leukemias. So any solid tumor cancer, minus the brain cancers. I've never had a test for anybody with brain cancer. But anybody else, you could try it. I mean, there's really, the only side effects that I've ever had anybody say to me is that it gave a little tummy ache. And honestly, I was not convinced that it was the fenbend that gave him the tummy ache. Could have been something else. The capsules of the supplements are taken and stuff. It is a powder. It comes in a little packet. You put it in a smoothie. Really doesn't have any taste. And remember, 1 packet is what you'd give a 10-pound dog for helping it deworm. So it's way under dosed for a human. Now you can get the mebendazole, which is the human form of fenbendazole, which is really the exact same thing, but it's much more expensive, and a lot of people would rather just get this, and then they don't have to go and get find a doctor that's going to give them a prescription for it. My wrist bones below my thumbs still hurt pretty bad. Even the skin hurts. My fingers are stiff and my thumbs lock up every morning when I wake up. I bought a new thumb CMC restriction splint and I've been wearing for 1 day, so not sure how much it is helping. I take a lot of turmeric, proteolytic enzymes, and even when I was taking 800 milligrams of ibuprofen 3 times a day after surgery, I had no effect on this. I tried the CBD topically and also DMSO. Is there something I'm missing? A supplement, maybe a Rife program while I'm watching TV or something? Is it a lack of estrogen from the hormone blockers causing this tendinitis, or the aromatase inhibitors? They have worn off since I have not had an injection over 2 months. I no longer have hot flashes. So I would say they've worn off, and your estrogen, your healthy estrogens are coming back into balance. But the pain is not diminished yet. Maybe it takes longer. Thanks. So with anything, my first thing is you gotta try to figure out why, right? So why do you have this? If it was from a restriction of estrogen, um, that's not something that I've heard of as having, musculoskeletal type pain from the restriction of estrogen. Um, so I don't think it was from the aromatase inhibitor. Is it from the chemotherapy drug? Probably. So there's plenty of documentation that chemotherapy drugs can give you hand and foot syndrome, which is really a peripheral neuropathy type situation where the chemotherapy medication damages the nerves. So that's probably what it was. Um, so a neuropathy. So a neuropathy is when the afferent pathway of the nerve is damaged. So afferent pathway of a nerve is the nerve that carries sensory input back to the brain. What carries motor input back to the muscle is the efferent pathway. So that's your brain telling your muscle to contract. But when you feel pain, numbness, tingling, vibration, hot and cold, those are carried from the tissue site back to the brain. So you have different receptors in your skin for those things. You have different receptors in your joints. You have receptors in your subcutaneous fat layer. So that when you touch a stove and you feel heat, it fires a nerve back to the brain and tells the brain in the parietal lobe that there's heat, and then that fires a nerve to the frontal lobe telling you there's heat, and then your brain processes that and fires an efferent signal to the muscle to jerk your hand away from that stove or out of danger. So what a reflex is a reflex picks up a sensory input, and it goes only back to the cord, does not go back to the brain, and fires back to the efferent pathway and jerks that nerve back. So you do have certain reflexes too. Now, neuropathy is when something damages the nerve. So the most common form of neuropathy is diabetic neuropathy. So it's increased glucose levels that damage the nerves. And it's typically going to damage, when you have a chemically induced neuropathy, it's going to damage the nerves in the periphery, meaning in the fingers and the hands and the toes and the feet. Because, how do you, when you have a chemical circulating your body and it dissipates into the tissues, it's going to have the most difficult time getting out of the peripheral areas because of just the location. So that chemical is going to settle there and it could damage those nerves. Now, because of the way your nerves are, there are what are called small diameter afferents and large diameter afferents. It's the large diameter afferents that carry these signals of pain and tingling. That's what's carried on the large diameter afferents, and they're the most susceptible to damage because of the physical attributes of the nerve sheath. So with chemotherapy induced neuropathy or diabetic induced neuropathy, glucose levels at being high levels can damage that large diameter afferent pathway, which is going to be, you're going to start to feel numbness, tingling, pain type things. Well, then what do? So you have to, work on trying to pull out that chemical. How do you do that? Well, that's where using the Ion Pro Wave on your hands. So you run the Ion Pro Wave, putting your hands in the bucket can be helpful. Using magnesium baths with your hands, just putting your hands in an Epsom salt bath in a little bucket can be helpful. Saunas, make sure you're getting your hands in the sauna so that you're sweating through your hands can be helpful. Your lymphatic drainage, hold your hands above your head and make sure you're exercising and moving it so you move that chemistry out of there. But what do you do once there's already damage to those nerve pathways? Well, then you have to stimulate those nerve pathways to heal. And you might be looking at wanting to get that tool called the Rebuilder. So the Rebuilder is the apparatus that was created specifically for neuropathy. It's separate from the TrueRife. It is FDA approved. It's got tons of studies on it for benefiting people with neuropathy of any kind, of any type. So if you look on our website, it's called the Rebuilder. It's called Rebuilder 300. I'll pull up a picture of it for you, and so you can see what it looks like. But it looks like a little TENS unit, but it's very different than a TENS unit. It's the way it works and the way it fires into your hands or your feet. You also have a bucket of water, but it has to be a split bucket. So you have to go to, there's information on our store about the Rebuilder itself. So you can look at that. But I literally, we've sold dozens and dozens and dozens of these for a decade. We've sold these for a long time, and people have had really good success with them. I got an ultrasound on my right axillary area because I felt a lump, and it turned out to be a residual seroma from the surgery. They also noted this: multiple morphological benign lymph nodes were noted in the right axilla with thin cortices and fatty hyla. When I scanned my left side for comparison, they found this. Comparative imaging on the left axilla demonstrates two adjacent abnormal lymph nodes with thickened cortices measuring up to 4 millimeters. Now they want to do a biopsy of one of these. Would these be new after surgery? I don't know if they were there when they clipped the enlarged lymph nodes before surgery. Does this mean if the biopsy is positive that my current program is not helping to stop recurrence? I am supposed to get my implant surgery on January 8th. Can I ask them to just remove those 2 lymph nodes while they're there? I just got this information yesterday and I've not spoken with my oncologist or my surgeon yet. I don't know what to do with this new information. Thoughts? Well, let's do this question first. Just got this information. Haven't spoken to them yet. So you need to talk to your doctor about whether they can remove those lymph nodes. They may push hard for getting a biopsy to see what they are first. And then because the truth is that if from their standpoint, if these are cancerous, they're not going to want to do this implant surgery, I don't think. I think that might be off the table if these are cancerous. And they'll be pushing hard for radiation or something like that. So we just don't know yet, we just don't know. As far as this question, does this mean if the biopsy is positive that my current program I think you're talking about your nutrition, your diet, your life is not helping stop reoccurrence. This is a common thought in people's mind. Because my cancer is getting worse, does it mean everything I'm doing just didn't work? Well, the answer is yes, in a way, it didn't work the way you wanted it to work, meaning it didn't make all your cancer go away and you don't have any problem right now. But the truth is that if you weren't doing everything you were doing, the truth is you could have been dead 6 months ago. I mean, you just don't know that. You don't know how well everything you're doing is holding things at bay, for as long as it possibly can. Um, there's there's only the bottom line is there's only so much human control you have over your life. I know we all want to feel, especially those that live in America, feel like we have full control over our destiny. And that if we just make changes, then we can change our destiny. Now, I'll guarantee you, just in time that I spent as a missionary in Mexico, where there was just we're working with just the destitute, impoverished people, they didn't come from the feeling and the background that they could change their current situation by making a few different decisions in life. Um, there was some things that they just couldn't change. I mean, there was just almost an impossibility of getting out of their situations. But we in America think that because we have had such affluence and because we're taught to be relatively narcissistic in our philosophy, even in our churches, that we have control over our destiny. And to a certain extent, we do. We were given free will. We can choose our diet. We can choose our lifestyle. We can choose our partner. We can choose a lot of things. But God constantly reminds us that we can't choose everything. You can't choose whether your heart's going to continue to beat or not, even if you do everything right. I can't tell you how many people I talk to on a weekly basis that say things like, I just can't believe I got cancer. I've been living this, we've been only eating organic for 20 years, or we've been doing, fill in the blank. And you think that because you're doing good things, right? I'm not arguing that eating correctly and taking good nutrition and making good lifestyle choices are probably going to give you better outcomes than if you did otherwise. But it doesn't mean that we're going to be, immune from heart disease or, cancer or vascular problems or a stroke or getting run over by a train. So things happen that are beyond our control. We live in a fallen world, and you do everything. I believe that from a biblical perspective, we're supposed to do everything we can do to an extent. If we become obsessed with getting our way, whether our way is to be cured of a disease or our way is to be financially independent, or our way is to be rich or wealthy, or our way is to have perfect relationships, or our way is fill in the bank. What is it that you want in life? Well, we've been programmed and conditioned to get what we want and to fight for and make goals of achieving that which we want. And in one sense, you could say that's a noble achievement, but in another sense, we have to be very careful that we don't step over that line into idolatry and self-indulgence and complete narcissistic behavior and being obsessively compulsive about our self and our narcissistic thoughts. Um, that's something especially Americans more than other people have to fight against. If you talk about your your daily fight against your flesh that the Apostle Paul spoke about, he probably didn't have, in the first century, Christians didn't have the same fight that we have as Americans. We live in affluence, and we are stricken with affluenza and thinking that we get our way all the time. And I'm not saying everybody's on this call because you want to get rid of your cancer, or you want to get healthy. And what the heck are you a doctor for if you're saying that you don't have control over these things? I'm saying you do everything you possibly can without becoming obsessive about it. You do everything you possibly can. Ultimately, you have to leave the results to God. And ultimately, everything that happens to us is supposed to, if we're believers, we claim to be believers, is supposed to drive us to a deeper relationship with Him. Otherwise, what is there a reason for living but other than to glorify God and to express His kingdom on earth through our love for other people? And for me, at least, I'll just speak for myself. I have to die to myself on a daily basis and die to my desires and die to my wants. If my cancer comes back, I'm going to be very disappointed. But then I have to, as a mature believer, get over that pretty quick. Are there some things I need to change and get back on my diet? Probably. Doing the more right things, yes. But if my cancer continues to progress and I'm going to continue downhill until my death, then I have to accept that and bring Him glory through that. And that's I'm not saying it's not hard, but I'm just saying that is really the good fight that we all must strive for, and that is the good life that that we need to aim for. That's the goal we need to aim for, is to hear, "Well done, good and faithful servant," when we're done with this path. I'm not talking directly to this person. Everybody just wants to get better. I'm talking to myself more than anything else. So don't think I'm harping on anybody here. So I'm harping on myself. And it's a reminder that's our good fight that we have to work on every day. It's dying to ourselves. Yes, do everything we can do, but then we ultimately have to surrender to, okay, this is not my way, it's God's way, and He's got a plan in this. How can I bring Him glory through it? Question from the chat. On the True Life programs under my name, there's a program called Short Day Program. When I click on it, nothing happens. Well, okay. Well, I'll have to look at that on your program. It might be a little glitch in there to copyright. So I won't be able to do it till Monday probably, but I'll look at your program. If you can send me an email to remind me, that would be great. Does ascites only occur in the abdomen? No, but ascites will occur in the body cavities. So ascites will occur in the abdominal cavity and in the pleural cavity, so in the lungs. So really in the lungs, you can get ascites in the pericardial sac, but that gets very serious. You don't typically get ascites in the pericardial sac from cancer, though. But you can get ascites in the pericardial sac from pericardial infection, and that could be deadly. And that's what was happening post with these COVID vaccines. That's where people would just basically drop dead because they got fluid in the pericardial sac, and it basically squashed the heart, and it can't beat and you die. But so from cancer, you can get ascites in the lungs, you can get ascites in the abdominal cavity. The best thing to do is to make sure, if you do get ascites, fluid in the abdominal cavity or the lungs, your body can drain that, but I tell you just feel 100 times better when you go get that drained. Pressure on your lungs or pressure in your abdominal cavities from I've had people have 5 liters of fluid taken off the abdominal cavity. Can you imagine 5 liters of fluid, what that's doing to squash your organs and fill your body up? It's just, carry that around, it's not good. To get that drained can be really, really beneficial. Is Fenbid good for metastatic prostate cancer? Yes, it can be. It can be. It's certainly worth trying. There really isn't a downside of Fenbid. So if you and back to that Fenbid question, that was where did I go over that? That was the protocol. Well, most of you guys are already taking curcumin and APOP, and many of you are already taking berberine and CBD. So just adding the fenbendazole would be all many of you would have to do to do that. Can you run through the Joe Tippins days of dosage for Fenben and the other components? So again, it depends on the protocol. So the standard protocol for somebody who's doesn't weigh a lot and their cancer isn't extremely aggressive at this time would be 1 packet a day for 4 days a week, along with curcumin, APOP, berberine, and CBD. And it's typically 3 curcumin a day. I think it's 2 APOP a day and 3 berberine a day and 1 dropper full of CBD. It's a liquid dropper. The entourage. And 1 packet, which is about half a tablespoon in that packet. You just put it in a smoothie, and it really has no taste. If you weigh 200 pounds, you might do 2 packets a day, 4 days a week. And you can play with that dose of Fenbid. I have some people that are doing 3 packets a day, 7 days a week, because their cancer's aggressive at this time and they're hitting it really hard with this. I've had lots of people turn their cancer around with that. So it's something worth investigating. I think I misspoke when I asked about whether the aromatase inhibitors cause the tendonitis. From what I've heard and read of women on estrogen blockers do get joint pain. I was just wondering whether it was because of the drugs themselves or to a lack of estrogen, or maybe it was the Kisqali. I think it was the Kisqali, which I haven't taken since September, but that's not usually a side effect. Usually it causes low white blood cell count. I don't think it, I mean, your estrogen levels after you've been off of this will go back into normal range. And so yeah, you looking at, if it is a neuropathy, then I would treat it with what I said. Tendonitis might be something different. Maybe you had weakening of a tendon and you strained something, but typically a tendonitis would heal over time. And if it seems to not be getting any better, then you have to look at other sources. Getting an X-ray done of the area, getting an MRI done of the area would be wise. Could lack of estrogen, another possibility, which I think would be remote, is when you could actually lose blood flow to a bone. It's called osteonecrosis. And maybe you end up, because of a lack of estrogen, ended up with osteonecrosis of one of your carpal bones. If you remember falling on it or remember injuring it or something like that, that's a possibility too. Maybe you were more susceptible to that. That's not an uncommon injury from a fall, especially the scaphoid or the lunate carpal bones. But that would be visible on an X-ray. So get some investigation done. Maybe by a local doctor would be helpful too. Maybe it's totally a musculoskeletal thing, not a neuropathy is musculoskeletal, but it's not. Maybe it's not a neuropathy. So ascites cannot occur in the neck, correct? Correct. So ascites would not be. You could get swelling. You could get fluid buildup anywhere, but typically that's not called ascites. So ascites is fluid buildup in a cavity due to, and understand the mechanism of ascites is not fully understood. There's just some thought processes on how ascites occurs. it's not. Some people believe that it's the cell membranes opening, and fluid escaping from the cells from the intracellular spaces to the extracellular spaces. None of that's been proven. So there's just some speculation on how that occurs. Would you take the FedMed protocol and ivermectin? Yeah, some people do. Yep. We have a lot of people taking FedMed and ivermectin. It does work on two different pathways. Um, so you can. Any other questions? Everybody having family over this weekend? Making a turkey and stuffing, mashed potatoes, corn, wild rice, squash. That's our menu. Going to family members' houses, that's nice. Told my daughter the other day, I said, I think one of the best turkeys I ever had was when we went to your house it was about 8 years ago, and you brined the turkey because we don't usually brine the turkey. I said, that was so good. I said, maybe it was just so good because we went to your house. We laughed and we laughed. And they're still coming over tomorrow, so that happened. Going hiking. Well, that's a great thing to do since you guys are away from home. That will be nice. All right. Well, I wish you guys all a very happy Thanksgiving. There's so much to be thankful for. Just try to remind yourself to wake up every day and just thank the Lord for giving you the ability to take a breath, and that He's got something for you today because He's got you alive today. So there's a purpose in everything. Know that you are blessed already tremendously, and stay focused on that. Know that I love you and I'm praying for all of you, and I will talk to you all next week. Bye bye.